Welcome to the Medical Device Made Easy podcast. Here is Munir Al-Azouzi from easymedicaldevice.com, and today we will continue what we have started last week. So last week we had the part 1 episode where we discussed specifically about the Corrigendum for class 1 devices, and today we will go through more details about that, but also regarding pure class 1 devices. Because even if you are pure class 1 devices, even if you are self-certified, there is still some requirements to follow. And Erik Vollebregt will really provide you a lot of great information for you to be still compliant. As I've said, my role is really to help you to place a compliant medical device on the market. And I hope by listening to this episode, you will execute and you will then not be trapped by any compliance issue. Don't forget, so you have still to subscribe to the podcast. You have still to provide your questions also. If you have some questions related to the previous episode or to this episode, don't forget to also go to the comments and just put a comment. I will send that to Erik and or if I can answer, I will answer it myself so that it can really help you. And if you have some colleagues that really need some support to understand the medical device regulation, the medical device standards, don't hesitate to share with them also this podcast. Okay, so let's listen to Erik Vollebregt.
One thing also that is important is the fact that even if those companies that have a class 1 device that is upgraded have an extension until 2024, they still have to respect some MDR requirements.
Yep.
There are the registration of economic operators, there are the PMS, etc., vigilance. So
Yes.
how they can do that now?
How they can do that now? Well, now still they can use whatever is available in the member state, of course. Yeah, but we had this fantastic plan of having Eudamed for that stuff, and then Eudamed was moved 2 years.
This is why I ask you the question, because I think this will not be applicable only for class 1 that are classified as this Corrigendum, but also for all the devices that are on the soft transition period, because they have to still respect this, but Eudamed will not be live, apparently, from what I heard, from what everybody has heard. So now what they should do with that?
Jokes about, yeah. Yeah, so I mean, what they'll need to do is, again, if we go back to the CAMD's FAQs from December 2017, they discussed the situation and they said, and it was question, what was it, 20, I think, 20, where they were really, really clear. I referenced that in my last blog post about the Eudamed delay as well. They said, if Eudamed is not ready, it means that you cannot upload whatever stuff that the medical devices regulation says you have to do and to make in Eudamed. But that doesn't mean that you don't have to prepare these documents or fulfill these obligations. You will just need to communicate them to whoever they would need them under the directives with the means that the directives provide. That's a bit of a convoluted sentence, but that's basically what it looks like. So the only thing you can do basically is to wait or to approach the competent authority that's responsible for you. So if you're a legal manufacturer in the union, talk to the competent authority of your union member state, or if you have an authorized representative, then see if the authorized representative can find out how it will work in that member state. So how are you going to register as an economic operator if there's not a Eudamed to register in? Nobody knows. You use the system that they currently have, or not excluded either, you use the system that they were developing prospectively to Eudamed, and which was going to work as a sort of shadow system behind Eudamed, for example, for registration and validation for the SRN purposes. Because if you look at how Eudamed was supposed to work, for an SRN, for example, a single registration number, you would obtain it via Eudamed, but the way Eudamed would work is that you request it through Eudamed, then Eudamed connects to the system of the local competent authority saying, hey guys, there's a request for an SRN, please validate. Then they do their own validation, and then they can input it back into Eudamed, and then Eudamed issues the single registration number to the manufacturer. So, for example, it's interesting. I was at the conference where a lady of the Belgian Competent Authority spoke in quite a lot of detail how the Belgian Competent Authority was working on modifying their back office systems in order to be really a back office to the Eudamed database, because Eudamed contains a lot, but these national steps it can't do itself, because it can't be 24 databases or 28 databases in 28 different member states and then all the rest. So it means that there will be national IT infrastructure and other infrastructure that is there or that's under development. And under the directives, member states have the liberty to require you to work with what they have. So that means that even in those 4 years or 4.5 years from now until the soft transition period ends, it might be that you have member states that change their IT systems 3 times. That could happen.
So it's mainly a situation that will be complicated for class 1 that are classified, but also for all the ones that are in the soft transition period. So do you think there will be also a communication like a MDCG guidance or something like that to help people? Because actually there was this information, Eudamed will be delayed, but there was no clarification in terms of, for example, economic operator, as you mentioned, how to register them, should we register them, how to register them, etc. So do you think there will be a guidance or some communication that will come out of that?
Yeah, there should be, because I agree, the situation is completely unclear. Because this FAQ document said, well, you have to do what the MDR tells you, and then you have to provide it to whoever wants it at a national level with the tools that they have at the moment. So that's kind of unclear.
And if they have no tool at the end, they cannot provide anything. And I think the competent authority doesn't want maybe to resolve that also, because they say, what should I do with that?
Well, exactly. And they also have no means to meaningfully share it with each other because I mean, if you look at it, Eudamed was really going to be like sort of the circulatory system for the MDR and the IVDR, because it's based on the situation that there's this single set of databases that connects to each other, and that contains everything about everything. It contains the economic operators, it contains the devices, it contains all the
vigilance, UDI,
SSCPs, all of it. And now that's not there. So you're in soft transition. Then the interesting question is, am I obliged to make an SSCP for my product in the first place? Because soft transition says vigilance, market surveillance, post-market surveillance, registration of economic operators and devices. Does not say SSCP.
Mm-hmm. So it means that we don't need that, or it means that it's unclear, or it means that, there is a lot of things that should be clarified here.
It depends on who you ask, because I think with Article 120, you can argue both ways, although I think it's more likely that they for devices in soft transition, things like SSCPs, for example, are not yet required. But you may also argue the other way and say, look, the MDR is applicable. And Article 123 is only about alternative structures.
So it means
that are related to the existing declaration of conformity or the existing certificate.
So as we said, so there is this corrigendum that came from class 1. There is this Eudamed delay that arrived. We see that there is some connection also in terms of activity for both. I don't know, but maybe there will be something coming later again. So we can say now that for people that the MDR is still not stable in terms of document, of text, of regulation, of what is written inside. So what we are saying today can change tomorrow. So I imagine that for us as people that are professional in terms of regulatory affairs, regulations, it starts to be a bit difficult. What about manufacturers that are there on the field and have their projects and have a lot of things to think about, and now they have to switch between one and the other? As soon as they hear about a new information.
Yeah, that's something I've been telling companies for quite a long time, is make scenarios for these kinds of situations. What will I do if this happens or if that happens? Because what you normally see is that companies, they take a linear approach to MDR implementation, and they will just say, okay, I will aim to have done project A by date B. But what they often don't do is that they build in, but what if project A actually turns out to not be the scope that I need, but I need the scope A plus. They often don't have any scenario for that.
Yeah, we talked about that, I think, on the previous episodes about Brexit, laying down service, etc. There was a lot of where we talked about scenarios.
Yeah, well, and this is one of these situations where you really need to think about if things look different. If you're a general in the army, this is what you're doing the whole time.
Yeah, true.
Because as there's this saying like no plan survives first contact with the enemy, and you could say, well, no transition plan survives first contact with the MDR. That's apparently how things are these days.
Okay.
So that's why you need to make scenarios.
Yeah, so for people, I also recommend you to go and read the blog post of Erik Vollebregt. There is a lot of details here. The last article was about this Eudamed delay, and there was a lot of the things that we mentioned today that were also included. So if you want to have a more deep dive on that, you can go and read the article, really excellent. Erik, is there another thing for class 1 devices, any information that you should provide to people?
Yeah, well, we've been talking mainly about class 1 devices that are covered by the Article 120, Section 3 possibility, right? The corrigendum.
Yeah.
But that only applies to the class 1 manufacturers that are not up-classified or that need an additional certificate like the class 1 reusable surgical instruments. All the other class 1s that remain exactly the ones that they are, and like, for example, the class 1 devices that remain a class 1 device under the MDR because they are non-invasive and are not classified under any other rule, just like the Rule 1 devices, those devices are still on the hook for full MDR compliance by 26 May. Even if they don't need a notified body. So for them, there is still a steep learning curve to go. They are affected by the Eudamed delay, which we've been discussing, but also they have to do all the other homework. So they still have a big gap that they still need to bridge, because they need to completely redo their technical documentation. They need to set up additional modules in their technical documentation, like the whole Annex 3 part, post-market surveillance plan and post-market clinical follow-up. And especially post-market clinical follow-up is something that these class 1 manufacturers have never been doing. Yeah. They may have done some vigilance, but they've never done vigilance in terms of post-market clinical follow-up, for example.
So there is a lot of, as you mentioned, also they had no contact with notified bodies, so they don't have all this mindset of getting in compliance with some documentation that we already know when we are in contact with notified bodies. There is a lot of things that they have to learn. But as we also mentioned, there is some companies that think now that as they are class 1, as there is no notified body, as there is no audit, they are in the safe side. They can create a technical file as they want and then put the product on the market. There is no risk. But as we mentioned, there is a risk.
Yeah, there is a risk because the rules will change a lot. For example, the MDR is about more data, really. So that means that even for a class 1 device, you need more clinical data to support your product. Clinical evaluation needs to be redone. And in the scope of this whole clinical evaluation redoing exercise, you will often find that you need more clinical data. And actually, this is one where the class 1 devices in soft transition, they are lucky because they get more time.
Yeah, exactly.
On the other hand, they will be up-classified. So they really have to go for this data like crazy now and basically post-market clinical follow-up the hell out of their soft transitional period, because they will need to also meet an even higher clinical burden, 2A, 2B, or maybe even 3, when they are finally MDR certified.
So it means that there is still some also misunderstanding maybe by some manufacturers that think that that it will be an easy path for them when it will not. So can we give them a quick advice, because now it's we are December. They have to be ready by May. Getting clinical data is not something that you can get just by few months, if I can say. Is there something that they can do and start to do now?
Yeah, it's like I can quote Immanuel Kant, one of my favorite philosophers, and he said, "Dare to be wise, sapere aude," and that's the only way to become enlightened. So they have to do something, so they have to go for this data, and they have to start closing the gap immediately, because there's still 6 months time until 6.5 maybe until they have to be compliant. So that means that right now, as soon as they finish this podcast, they should immediately dive into their data and start to see, how can I actually get to the level that's required, and how can I make these couple of months count. Another one, that's also something I see with class 1 manufacturers as quite problematic, is an ordinary class 1 manufacturer has been operating an Annex 7 quality, well, you can't even call it a system, I would say, under the MDD. They needed to do some vigilance, they needed to do some post-market. If you look at the MDR is much more strict, has a much higher baseline for quality system. And that applies to everybody. If you look in Article 10, Section 9 of the MDR, that says everybody needs to have this quality system at least. And if you look at what that means in the MDR, it's a quality system that goes even beyond the ISO 13485-2016 standard. And there's a pretty good technical report by ISO that, or I'm not sure it's by ISO anyway.
I can't remember if it's by ISO, but I have the number, so I can put that on the show notes for people to get that. It's a comparison between MDR and ISO 13485.
Exactly, yeah. That document shows that even if you are fully ISO 13485-2016 compliant, you are still not there.
Exactly.
And I can tell you, it is a big gap from Annex 7 MDD, if that's all you were doing, to Article 10, Section 9 MDR fully compliant. Because, I mean, yeah, that document shows that it's a really big gap.
Yeah,
And that is, I think,
it tells me
something.
if you are if it's completely covered, if the MDR requirement is completely covered by the ISO, or if it's partially covered or not covered at all, or etc. So it's also showing you some of this.
Yeah, and it means that you have to do a really big quality exercise as a company. And I think that most companies are, they don't realize how much work that is to get to that kind of level of quality.
Yeah, I had, just for a story, I had some people also contacting me from the US that have a class 1 device exempt. And they want to put it on the market in Europe. And they were saying to me, it's crazy how much it costs to be in compliance with the European regulation when we are class 1, when in the US it's not it costs not so much. And now, they are starting to really see that all the requirements can cost money to create a technical file, to create a quality management system that is compliant, to find an authorized representative also, etc., etc. So there is a lot of things that have to be done. And I had a lot of companies that were really surprised by how much it cost.
Yeah, and also how complicated it is, because I mean, Europe is going to be very complicated in let's say the coming year, because we have a Brexit or not.
Yeah.
We have a Swixit or not. We might have a Turks never happening situation.
Okay.
And then I mean that makes it very complicated.
Okay, so Erik, I think we have now provided really a lot of information for people about class 1. We really covered class 1 and class 1 up-classified and also class 1 normal devices, so that people have no confusion and they really understand what they should do to be compliant. Also, warning, there is, if you are not compliant, there can be also a retrospective check of what you are doing. So don't assume that, nobody caught you, so then you are on the safe side. No, there is still a retrospective check. And there is also a lot of things that you have to be checking, to be putting in place, as we discussed about the quality management system, the technical file. Eudamed also is a topic, so we have also covered that. I think, we have really reviewed all the aspects of class 1, and I hope that now manufacturers are ready to start the work, if I can say, to be compliant by May 2020 for those that should. And by May 2024, there is still a lot of work to do for some companies. So don't just remain seated and say, "Oh, it's fine, I have still some time." You have to find your way also there. You have to find also a notified body. I hope you will find that also, and be able then to be receiving your certificate. Okay,
can I make one remark there? Because what I see with that's many of my clients that are class 1 in soft transition.
Yeah.
So software companies are saying like, so we have a declaration of conformity and it's valid until end of May 2024. Yes. Okay. Then we will aim our MDR certification as close to that date as we can. That is stupid. It's suicide. Why? Because a lot will be happening then, because all of the class 2A and higher devices in soft transition, they will also require their MDR certificate then. But those guys already have a notified body. And these class 1 devices in soft transitions do not have a notified body yet. So that means that if you are going to try and climb aboard of a notified body by the beginning of 2024, you are completely too late. You are totally too late. So my message to the class 1 manufacturers with an up-classified device under the MDR would be, do not wait until 2024. You're always too late. Do not even wait until 2023, because you will be on the bottom of the pile of the last notified body that will still have you. So do be clever and go actually to the MDR as soon as you can. 2021, maybe, when the first big wave has passed, through 2022 maybe, but not later. Because as soon as you are, I think, later than that, you run into the problem that you're going to be in a queue and you're just going to be too late.
Great.
Sorry to put that in at the end, but it's really important.
It's completely fine. I think, manufacturers should really listen to this wise message from a wise man that's really had a lot of experience now with manufacturers because, I confirm that there is a lot of things that will be ongoing. So be on the safe side and try to secure your company as soon as possible instead of waiting until the end. Okay, Erik. So I think it's a great information that we provided today, and I hope they will listen to us and will listen to what we are saying. If you have also, so for the audience, if they have more questions, so please don't hesitate to put some comments on YouTube or on LinkedIn or wherever that you see this message. If you have some question, I will pass them to Erik and he will try to answer to those questions. And also for the people that are watching this episode and are listening to it, please don't forget to subscribe, to provide also a review. I'm looking at all your reviews and thank you for that. It gives me a lot of feedback. And also to share this episode or the episode that you are looking at with your colleagues, because I think the message that you are providing can be also listened by a lot of your colleagues. So don't hesitate to do that. Okay, Erik. So thank you for your time. Thank you for all the information and I wish you a nice day.
Nice day to you as well, Monir. Bye-bye.
Bye.